Well, as you well know, the building was completed in 1980, and that's when the first use of that lab was. So here we are, what, 29 years approximately, and the old equipment was still in operation. And so we started planning the change of that in phases, phase 1, 2, 3, and 4. We're in phase 3, really. Phase 4 is a separate room. It's part of the wet lab, so we're doing the main lab, and we've been planning that now for 3 years. And we started it in May of this year, and we hope to occupy it in October. Everything looks like it's on schedule. The difference in this renovated facility now is that the students will be doing more realistic practice on mannequins that we call simulators, and it's actually the newest state-of-the-art simulator that we're be the first school that actually has these installed in the United States and the world as far as that's concerned, this particular simulator. And it prepares the students to be a little bit quicker in understanding how to work with patients and working in the real mouth, so to speak. And it gives them a better ergonomic training, and that's one of the big issues that dentists have over time is the ergonomics and body positions and back positions, so we can start training them from day one in proper ergonomics to make their practice life better and more efficient as well. We've also increased the space between the aisles so that the faculty and the students will be able to interact much more easily without being so crowded. The other thing is that the configuration we've increased the monitor size for the students to view, and we're in a proposal to be able to do some three-dimensional use of those monitors for the students so that they can see things in a 3D as opposed to just a flat screen. And so that's part of the virtual reality expectation that we're looking for. And we're also having the facility will be equipped so that the students can use either the common air-driven electric handpieces and or the electric handpieces. So it prepares them for more universal ability in the practices. Well, I think the important thing from the community and the Alumni Association, the alumni individuals and contributors, is that they recognize the value of the preclinical simulation training for the students in the ability to go into practice, ability to work in the clinic after the preclinic, and the ability to have the flexibility in the curriculum to make things as efficient as possible. Because one of the things that we're adding to the curriculum is a portfolio in which the students can demonstrate exactly what they've been learning and what they're doing in a visual system as well. It's going well. Like any renovation project, if anybody's ever remodeled their house or kitchen or bathroom or anything else, there's always things that show up that were not forecast and not exactly on the original blueprints and so forth. So we've had to make some slight adjustments, but having the one major donor allowed us some flexibility to be able to make some contingency plans and all the individual contributors, so that's been really helpful to have the funding to be able to do these contingencies. The manufacturers we've worked with are primarily certainly the local contractor and all the subs, and I've been working with them, and it's just been outstanding how cooperative they've been, and I've been pushing them very hard so that we can make sure we get the project done on time. And I've been very successful in all my other renovations in that building to finish them on time and or early. I'm still optimistic that I'll finish this one at least on time, if not a little bit early. And the donations that have come in and will continue to come in, we're really appreciative of. The students really appreciate it. I think everybody that views the facility when they see it finally open will be happy as how it operates and looks.